Good day to each and everyone joining us here in person at the University of Makati and through Google Meet. I am Vincent Barcelona from the Center for University Research. Welcome to CR's Research Colloquium. Our topic for today is Achieving University Excellence Through Research. Today is day 2. Our event aims to encourage all faculty personnel and students to participate in research-related activities and or do research. This colloquium will be a series of lectures or trainings that aim to provide us with a better perspective toward research. For those who are joining us online, the evaluation form will serve as your attendance. For the attendees that are here with us physically, please make sure that you have signed the attendance from outside. The evaluation form link will be sent to your email address after this program. To all attendees, please make sure that you have accomplished the evaluation form to receive your certificate. Just a few reminders for those participating online. Please make sure that your microphones are on mute until you are recognized to speak. Feel free to use the chat box if you have any questions. We will be collating them for the Q&A portion later on. Let us officially start our program, ladies and gentlemen. All rise for the ecumenical invocation, the singing of the Philippine National Anthem, and the Alma Mater hymn. To lead the ecumenical invocation, Mr. Carl Joseph Gadding.
Dear Father, thank you for bringing us together today in a spirit of generosity. May we honor one another by keeping an open mind. May we voice our truth and listen with an open heart. May we discern your will to unite in a fruitful outcome.
Bayang magiliw, pero sa silanganan, alam ng puso, sa dibdib mo'y buhay. Lupang hinirang, duyan ka ng magiting, sa manlulupig, di ka pasisingin, sa dagat at bundok, sa simoy at sa langit mong bagaw, may dilagang tula at awit sa paglayang minamahal. Ang tislap ng watawat mo'y tagumpay na nagniningning, ang bituin at araw na kailan pa may di magdidilim. Lupa ng araw na buwan, hadit pagsinta, buhay langit sa piling mo. Aming ligaya na pa, may mga api, ang mamatay ng dahil sa'yo.
University of Makati, rejoice we're here onward marching, be it shine, storm, cloud, or rain. Let all our voices keep ringing for the glory of our alma mater, pride of Makati and our fatherland, beloved UMak proudly stands. Arise, my sons and daughters, fill the air with the joy of alma mater. We're our gladness
All may now be seated. Leading the center's goal to provide technical research competence to UMak faculty members, students, and administrative personnel, let us welcome the Center for University Research Director, Florante E. de los Santos, for his opening remarks.
The year was 2019. That was the time that I was designated as director of the Center for University Research. And the first reaction when I was given the task was to say that I may not be able to meet the requirements of the job because I'm not an expert in research. Okay, that was my feeling back then. But I told myself, well, I think I have no choice but to accept this. So I immediately drafted and updated the research manual. That was the first thing that I did back then. And then requested for some peer reviewers from other universities because I know I'm not an expert. So I had to seek the assistance of people from other universities, from Ateneo, my friends from La Salle, from UP, even from Spain and from the US, in order to help us evaluate the papers being submitted for publication in our official university journal, the Universitas. And so, and then the next thing I remember, I immediately came up with the deloading and overloading policy for those faculty members who would like to come up with research. Because I know that they are busy with a lot of academic requirements as a teacher. So I thought, I think we should give them some sort of a privilege or an incentive by giving them an overload or deload privileges. Aside from that, I said, I think the Universitas has to have a template. So I came up with a template for those who will be submitting their papers. And then it did not end there. I have to have our Universitas index locally. So we applied for the Andrew Gonzalez Philippine Citation Index in 2021 or 2022. And of course, we met all the requirements, and luckily we passed the rubrics given by them. So we had to publish at least 2 journals every year, maintaining the standards that we said we have to have, and that because AGCPI will be monitoring us, so we really have to do our best, in meeting the requirements. And then last year, we attended, because we thought of accrediting our research ethics board. So we have attended 4-day training for the selected faculty members for us to know how to get accredited by the Philippine Health Research Board, PREV, the only accrediting agency for research ethics committee. And so we formed as well the UMREC, or the University of Makati Research Ethics Committee, so that all the papers, including the undergrad and the grad papers, thesis and dissertation, would have to pass through first the Research Ethics Board. And now we're praying that PREB would grant our accreditation eventually. It's now in their hands because we have already submitted the SOPs to them. So we're still waiting for their approval. At any rate, even if they don't approve of our requests, of our accreditation, we still have to maintain our research ethics board. All papers will still have to pass and reviewed by the members of the UMREC, okay? And of course, every year since 2019, we have been holding the University Research Congress, started by no less than the Vice President for Finance, Sir Luc Ivan Moro. Thank you, sir. You actually inspired us to really proceed with more wishes for the university to have, okay? And so we have been indexed, and we have also been recognized by the Philippine e-journals. We now have worldwide visibility. And not just that, I thought I would wish for more. I might be asking for the moon, but I would like the universitas to be indexed by Scopus as well. So, but of course, I cannot do that without you guys, without the students, the faculty members, the admin people. And by the way, our Mayor Abby Binay and the management committee of the university have been very supportive of all our research endeavors. No? Whenever I ask for a policy to be what do you call this? To be approved and to be implemented, they would support all these policies. And so far, last time we have, 2 weeks ago, we have requested for approval of 11 policies, and they were all approved by the management and by the executive committee. So thank you so much, Sir Ivan, Ma'am Yusek, Net Cariaga. You have been very supportive of our endeavors. Not to mention, they also are contributing a lot of papers to the journal, to our journal. So this talk is actually part of a series of research-related events that we will conduct. This is, I think, the 4th one that we will have. And this will enlighten us definitely, because earlier I was having a chat with Dr. Don ELISEO, and I was trying to tell him that this is our situation right now, and I want to be very realistic that we are a very young research center. Even our journal may not be that good, relatively good probably, but we're still hoping that we can come up with better outputs eventually. And with that wish in mind, that eventually we can be indexed by Scopus, no? And so I welcome you all, no? Ang dami kong sinabi, I'm sorry. I'm just so excited about this talk. So I welcome you all to this activity, and I hope it will further encourage you to write your research and to collaborate with the research center, especially now that we are trying to maintain more our integrity in the face of the ChatGPT and all these things. So I think we really have to do more in facing all these challenges. So thank you so much, and welcome to this talk. Thank you.
Thank you, Sir Ranta, for a trip down memory lane. It is really a cause for celebration how the center have gone so far. It is also an honor to be with Sir Ivan today, our former director. We, the students, faculty, and staff, will be working together so that Universitas will eventually be Scopus indexed. A round of applause is in order. So, without further ado, I have the honor to introduce our today's lecturer. A PhD alumnus in Global Health at Cardiff University, Master of Public Health at the Royal Tropical Institute in Amsterdam, Master of Science in Health Economics Policy and Law in Global Health at Erasmus University in Rotterdam, the Netherlands, Diploma in Social Science Research Methods at Cardiff University, Certificate in Professional Studies in Learning and Teaching in Higher Education with Merit at the University of Liverpool, a fellow Scholar ng Bayan, Bachelor of Science Psychology, cum laude, and Doctor of Medicine at the University of the Philippines, he's a global health scientist whose work focused on health equity, publishing 308 scientific articles, book chapters, and scientific reports. He is also known for his global work in advancing science and research, particularly in the developing world and in addressing health research inequity. His scientific work is hinged on creating evidence to influence global health policy and practice, improve the health of populations, and achieve global health equity. He teaches economics of global health policy at the London School of Hygiene and Tropical Medicine and International Health at the University of the Philippines Open University. He is an adjunct professor of Mahidol University, where he teaches global health in the PhD program, and a visiting professor at the University of Botswana, where he supervises a study of schistosomiasis in Okavango Delta. He holds visiting professorships with Cardiff University in the United Kingdom, Wuhan University in China, Naresuan University in Thailand, Astana Medical University in Kazakhstan, and Taipei Medical University in Taiwan. He was recently a visiting scientist at Harvard University, the country director of the think tank Access Health International, and an associate professor in public health for 10 years at the University of Liverpool. He is one of the very few Filipino chief editors of major international journals, editor-in-chief of Public Health Challenges of Wiley, and deputy editor-in-chief of BMC Global Health Research and Policy, a Q1 journal. He is the founder of Global Health Focus, a leading global health emerging leaders program in Asia and Africa that has produced 20,000 young researchers and emerging leaders in global health. He has been assisting governments and universities globally in strengthening health research capacities. He is a member of many international research groups working on many different health issues globally. He has consulted for the World Health Organization, the World Bank, the Asian Development Bank, and other United Nations organizations and international agencies. He is currently a health financing specialist for the Asian Development Bank, assisting the Philippine government on its universal healthcare implementation. His global work has been recognized through many awards. He has received including the Outstanding Young Man in Global Health in 2009 and the Distinguished Alumni Award in Global Health from the University of the Philippines in 2011. Ladies and gentlemen, Dr. Don Eliseo Lucero-PRISNO III.
University of Makati, to the academic leaders of the university, to the research office, to the researchers, faculty members, and of course to the students of the university. While we are fixing the laptop for my presentation, so probably I know you have a journal here in your university. But probably it will be the first time for some of you to be engaging with a chief editor of a global journal. I am the editor-in-chief of Public Health Challenges. It's a journal by Wiley. There was a global search for an editor-in-chief during the pandemic. And I'm also the deputy editor-in-chief of BMC Global Health Research and Policy, which is a Q1 journal, and which we babied from the very start. It was like so chaotic when we started the journal, and then we started it from nothing, and now it's a Q1 journal, meaning it's one of the top in the world. There are thousands and thousands and thousands of journals, and it's like top 14 for health policy, top 15 for public health, those kind of things. So what we're going to discuss today, this will be a conversation with the university. And imagine University of Makati being one of the best universities of the world. So that will be our goal after this presentation. So I know this is recorded, so I hope we can replicate this lecture with the other faculty members of the university because we need to work together as one university, including the students. So I have been speaking to thousands of universities all over the world. I have been working with many universities from the different countries all over the world, particularly in Asia and Africa. And we were able to be, we were successful in getting them higher in the ranking. And that is what we're going to do now. And so I entitled the presentation today, Achieving University Excellence Through Research. But what is it for us to be an excellent university globally? There are so many reasons other than pride, because pride will just be there. But it goes beyond pride. There are many practical reasons why we have to strive to be an excellent university. For some of you students who will be working in the field of health, whether you're a nurse, you're a pharmacist, for some of you who will go abroad, when they say that you're a graduate of the University of Makati, then everyone would know that you come from a very good university. So that's part of the pride and that's part of the recognition. I have been working with many top universities of the world. In fact, I teach with London School of Hygiene and Tropical Medicine, which is part of University of London. And I have been teaching for the University of Liverpool for a decade before I took a sabbatical and I was headhunted to go back to the Philippines to head a think tank which helped the government. And the introduction showed that I am a visiting professor for many universities. That is one of the perks of someone who has been, I would say, sort of excelling in the field of health and research. But more than that, of course, I am doing my work because I am very enthusiastic of really creating evidence from the ground and translating it to policy and practice. That is the way I frame my work in my research. Because you are the ones who know the things happening on the ground, whether it's in Africa or in Asia, and you are the best ones who should be doing research of the different things that you see. We are in the tropical region, yet most of the books that we read here by the students are written by professors who are not even in the tropical region. You know that Harvard and the US, they have snow. But here we have all the diseases. We have most of the diseases, and that's the same thing with Africa. So that's the grounding with my work. And with the work that I've been doing, and one of the perks of being a good scientist and a good researcher is actually you get recognized. As mentioned earlier, one of the prestigious awards given by the president of the country is Outstanding Young Man of the Philippines. And one of the more prestigious award, which you probably would be getting if you would be excelling, would be being one of the outstanding alumnus of the University of the Philippines. And I had the chance of being awarded together with the vice president of the country before. And that's, of course, one of your founding fathers, former Vice President Binay. Imagine, if you're a young person, you know, alumni awards are normally for older people. That's what you'd expect. But if you are a young person and together awarded with the top officials of the government, secretaries, then you have achieved something. And that is part of the research output that I have been doing. I have been recognized with that. But those are just some of the perks of being a scientist and being a researcher. That is not what we're going to discuss today. That was just part of the motivation that I want to tell you as young people. So later on, the students, you will see that I have been training and leading global health programs where I trained many young students in pharmacy, first year, second year. They finished their undergrad with more than 100 publications in top journals. That I was able to bring them to the top universities of the world because research is your ticket to get into the top universities. In fact, I am going to tell you that research is a way out of poverty. And that is what I've been doing in Africa. On the side of the university, While the faculty members, researchers, scientists, and the students are doing research, the name of the university goes higher. Because later on, I want to show to the university that Makati, University of Makati, has the ability, capability, and all the resources that it has, and it can be used to become one of the top universities of the world. You know why? Philippines is lagging behind in terms of top universities. I'm a consultant for a number of universities in Sri Lanka, which is having a lot of economic problems. Their universities are top 100 in Asia. It's even top 50, University of Peradeniya, in the world. Okay? Universities in Vietnam, Kazakhstan, they are now top 100. Go to the ranking. And the Philippines is having difficulty bringing its universities up when in fact we speak better and write better English. Have you noticed that? So there is something wrong with the way the universities are doing okay, we're very good with academe, the board exams, we always pass them 100%. But research is one of the ways by which you can catapult the university to the top ranking. I am the editor-in-chief of Public Health Challenges, that's Wiley. And there are just a few Filipinos who are editors-in-chief of big journals. So I know one, he's a Filipino, but he's from Massachusetts Institute of Technology in the US. Of course, there are Filipino journals, one or a few, and they're Filipino editors-in-chief. But when we go to the big publishing houses, such as BMC and Wiley, there are very few, and I'm luckily one of them. Being an editor-in-chief is a tough responsibility because you are laying the ground, you are placing the landscape of global scientific research. That is the beauty of being an editor-in-chief. It is like the editor-in-chief of the Vogue magazine. When the Vogue magazine comes out, the rest of the fashion of the world would be influenced. Remember, the fashion that you buy at the stores in Makati is not done during that day. It was already set 6 months to a year before. The editor-in-chief sets the agenda, sets your color. So if the color that I want for next year will be earth colors, we will already set the agenda, let the dress manufacturers do the production of the dresses, and then release it during the time of the season. That's how powerful editors-in-chief are of big journals. So for universitas, that is the way you will think of your journal. Something that will influence the landscape of research. So we have big journals which has a big which influences. Of course, we have Lancet, we have New England Journal of Medicine, and that is the way I'm looking at my research and the way I look at my journal. So I'm, first of all, a scientist doing a lot of evidence creation. And secondly, I'm into journal leadership and management. But overall, I looked at all of this as part of the evidence so that what I'm doing as a scientist and what I'm doing as an editor-in-chief is to impact global health, research, and policy and practice. So that the ones you will be reading as students will be based on evidence, and that will translate to longer life, better health for the populations of the world. So I have that bigger picture as a scientist on the way I do my work. And that is also how we will set the education of the university. And that is the only way you can become a very important university if you start influencing the world. You are not a local university. All universities now are international. You can accept foreign students, you can accept foreign teachers, but then again, why are we not able to penetrate the super brands, for example? And so we will see later on how your research will help the agenda, how the journal will help the agenda, and how the students will be taught research-led teaching and research-based teaching. But that will be a different lecture on how you set up the teaching based on research. Those are two different paradigms. Now, why is it important why we have to do research? So I would normally do workshops, which we're not able to do here in your university, on why the faculty members and researchers and students should be doing research. Of course, it's for personal promotion, professional growth. You incentivize them. And for some, they contribute to the knowledge. And of course, it contributes to the university's ranking. It is a basis for development, so on and so forth. Now, I divided the different reasons why we do research. Let's just go to the macro level, which is, it really helps the country. During the pandemic, what research that they had to do fast? The development of vaccines. Who were given the billions of dollars for the development of vaccines? Researchers in the top universities. So if your university is well known, money will just come in. You just don't wait for it. Someone will just put money in your university. That is why one of the reasons why we have to do research is to put the name of the university up there, because it will translate to income. You don't have to wait for the budget of the government. That is why in other universities like Harvard, Yale, the university provost or the vice president for academics and research is assessed based on the amount of money brought in under his or her term. It's by the billions, especially if your research is on sending rockets to Mars, if you have space science. If it's vaccines, then it's billions of US dollars. Who are the ones developing vaccines? Not the Philippines, but Vietnam has been developing vaccines. Thailand was producing vaccines, COVID-19 vaccines. The Philippines was not. In fact, the very first testing of our COVID, where was it done? The very first few specimens of COVID. It was sent to Australia. And then we had to wait that it was COVID. That was the first few cases. Until the World Health Organization started to push that everyone should be having their own testing. Now, at the university level, why it is important to do research? Because research is a ticket towards excellence. If you have influential research centers, such as, for example, a center for good governance, or a center for urban health, or a center for pollution, or a center for addressing urban poverty, we have a lot of problems in the Philippines that we have to address. And the solutions can only be done through research and through the creation of evidence. That is why we are called a university, because we produce knowledge. And production of knowledge is not done only by, it's done by research. Teaching is another major activity of the university, but most of the time, Philippine universities are based on pedagogy. We just keep on teaching and teaching. In fact, I've been talking to many universities in the Philippines, particularly the private ones, and they love teaching. You know why? Because when they teach, and there are thousands of students, they get more incentives because they have extra hour of teaching. So they go home with a lot of money. That's good. That's not a problem. But becoming a researcher does not necessarily mean that you are poor or you don't have money. In fact, you can get rich. You can be incentivized with research. And that is what we're going to discuss later on. So at the personal level, there are so many reasons why you have to do research as early as possible. You develop the competency of scientific inquiry. Whatever you ask, the way you answer the question is done using methods, for example. And you become more competitive. Even if, for example, some of you are, what are the students here? What are their pharma? The ones here. Okay, very good. Because the ones I'm going to give examples later on are mostly Africans and some Filipinos who are pharmacy students and nursing students and medical students who are now at Harvard, at Oxford University, because we have been doing a lot of pharma research. And that is what you have to be challenged with. So you become more competitive. When the young students here, the young faculty members here would apply for master's programs, you know, everyone is a leader, so all the CVs are the same. Everyone has good grades, so all the CVs are the same. But not everyone is doing research. That is where your edge is. Because you are an undergraduate student does not mean that you cannot publish papers. We have been doing that, and you can publish papers because papers that come from you are also very important. And so you become critical thinkers, and probably some of you will even become Nobel Prize winners in the future. There are so many awards, and you know, if you're a Nobel Prize winner, you will receive $1 million US. But of course, that's just an incentive to do that. And that is the same thing with the faculty members that we have. Some of the faculty members and some of you who will be in the academe might probably become the national scientist. And guess what? Where will you be buried if you're a national scientist? Saan nililibing ang national scientist? Libingan ng mga bayani because they are considered national heroes. Only the presidents and the national heroes are buried there, national artists and the national scientists. And there are many incentives to be an academician or to be a scientist, because as an academician, for example, of the National Academy of Science and Technology, you will be incentivized by having a higher benefits in terms of retirement, so on and so forth. Now, for the young people, I want you to be ambitious. I received this award, the Outstanding Young Man, which was mentioned earlier, and it goes to the top young Filipinos all over. And normally, they cannot find 10, so they changed the 10 to the Outstanding Young Man. We were just 6 when we were awarded in 2009. And a number of them would come out from the research community. So for example, of course, you have the mayor there of Pasig. Raymond is a scientist, and Edgar is a teacher. I think it's only Raymond there who's a scientist from UP. And so that's what the university should also be doing. You should be identifying some of your young faculty members so that you can nurture them to be excellent in their craft, and you try to push them or try to nominate them to prestigious awards. And so the awarding normally is done at Malacanang Palace. Now, there are so many of you who would be interested in doing research because there are so many incentives. Later on, I will show you that writing research grants is a way of making money. For example, if I would push the University Research Office to be writing grants, because you don't have to keep on waiting for government grants, because private grants are actually faster. 100,000, 200,000, $500,000. For example, my grant would now amount to $4 million US. And these are just basic researches for some of them. Some are projects. And a grant, 40% would go to human resources. 20% would go to administration, sometimes miscellaneous. So if it's a $1 million US grant, you're already assured that you have 200,000, which is meant for savings, and that will keep the university research surviving by having more research assistants and research associates. So you are sustaining the university research center. And of course, you come up with a grant writing body. There are so many call for grants all over the world. from the Gates Foundation, which gives billions and billions and billions of US dollars, to Rockefeller Foundation, to the Ford Foundation, even to the embassies here in Makati, especially when the year is already finishing because they have extra money. So we don't have to wait for the Department of Science and Technology for the money that comes in. And so some of you might become national scientists. For me, the beauty of research is actually the impact that I'm doing. For example, for my PhD on, one of my fields is maritime health. I look at the seafarers, the people working on board ships. I understand that you have maritime studies before, used to, but because you don't have a port, probably that's why Marina did not allow it. They're becoming very strict because they are being checked by the European Union and all. So one of my research areas, I'm a medical doctor, but one of my niche areas is maritime health. So this is another strategy for the faculty members who are here. You can do lots of papers and lots of researches, but you have to be best in one or two areas, because that is where you will be known for. Okay? So one of my areas is maritime health. So for my PhD, I had fun with my PhD. I was looking at the sexual risk-taking behavior of global seafarers, mga marino. I studied in the UK, but I did my field work in Brazil. So every night, I was in the bars at the red light district. So yung mga barko dumarating, nagtatrabaho yung mga seaman, pagdating ng gabi, bababa sila at makikipag-associate sa mga sex workers. It is legal with sex work in many countries. Sex work is different from prostitution. Because sex work, you get paid for the work, meaning you have clients. Prostitution is when someone takes care of the sex workers and they're the ones getting the money. So it's at your own volition that you are doing the sex work. And of course, because it's work, what do you do when you work? You get an income, and what do? You pay taxes. Very good. So that means you can get a receipt after engaging with a woman. And that's what happens in the Netherlands. You can ask for a receipt if you go for sex work. For the sex workers. You're not the sex worker. Oh, but that will be another research lecture in the future that will be interesting to talk about my research. Now we're just going to talk about research strategies. So that policy, where we have seafarers, alam mo mga marino, minsan 5 years sila nasa barko hindi umuuwi. Oo. Normally, it's 8 months. Minsan kasi walang inuuwian. So they would stay on board for 5 years and they just keep on earning money. And that distance from the family, from the loved ones, puts them at risk to engage with sex workers. And of course, they simulate relationship with the sex workers, so they look at it as a relationship, thus the non-use of condoms. So therefore, HIV transmits, and then we will question, can he be compensated if the person is infected with HIV? Yes or no? Because it has nothing to do with his work. It's not occupational disease. Because of my research, eventually the court agreed that seafarers who get HIV infected will now be compensated by the court, by the insurance companies, even if it is not related. So that's the impact and the beauty of research. And that's the same thing with what we did. We did a systematic review of trafficked commercial fishers and seafarers in the Mekong region and in Southeast Asia. It became a program of the International Labor Organization. That is the reason why I was awarded the Outstanding Young Man of the Philippines, because of these things that I have been doing as research. Now let us look at your university. How can we make the university top in the ranking? I understand that you haven't applied for the QS ranking. I understand also that SHED has been giving money, 2.4 million, so that you can register to be ranked to get a 1 star, 2 star, until 5 stars. UST has 5 stars. But most of the universities that got ranked paid by CHED got 3 stars. Okay? So 5 star is the highest. Now, if you are ranked by this by this ranking body, then that means you're really a university that is start to excel. So therefore, from then on, we can look at your trajectory as a university. So that's one. We can look at the H indices of the faculty members. So if I were going to help you later on, I would like to have a survey of all the faculty members. What are their current H indices? And then if I click on University of Makati on Google Scholar, I will see all the faculty members who are publishing. Then I can monitor it across time. Remember, there's another indexing, not an indexing, but a ranking body, which is the AD index, which I do not necessarily subscribe to. Have you heard of AD? Yes. When you're very high, you put it on the website and you highlight it. It's just the basis is just H index. So if you like that index, then we can play that game. Because we are just going to play a game of numbers later on. That's what we're going to do. Remember, there is only one metrics of all of this, whether it's Times Higher Education, QS ranking, Shanghai ranking. What is that? Metrics. That is measured, that feeds to all of this. Research through citations. Only that. No other metrics. I do not agree with that, but I have to work with that at the moment because that is the only most objective metrics that we have at present. Because the impact of the university is not measured on citations. The impact of the university is measured on its impact on the community, on the country, on humanity. But it is very difficult to measure this objectively. So in the United Kingdom, the government has specific measure of the impact of universities. They have the research, academic, assessment excellence. But they really do interviews with the faculty members, but that's for all the members, for all the universities in the United Kingdom. That's a lot of work because it's done every 3 years. But for this metrics, you will see that it's only through the production of paper, every paper that comes out from the students, faculty members, researchers, will be cited and will be analyzed, and that is what will feed to the QS ranking. Later on, we will see what the details are. If we know that these are the rules, then we have to start from the very basic. Production of papers. I said papers. I did not say doing 5-year biology research. I did not say that. I did not even say 3-year work on nuclear physics to produce 1 paper. I said just papers. Okay, now you're getting me. So there are many ranking bodies, but so far what we're using is the QS ranking here in the Philippines. But of course, Times Higher Education, you will see later on that there are what you call super brands of universities. Now, the latest ranking in the university is this one, 2023. You still cannot be ranked because you haven't applied, okay? Which means you have to apply to get ranked because ranking is a business. And what do they make out of it? The data is being bought by the different organizations, by funding agencies. So if you will notice, there are many universities from the different parts. This is just Asian, okay? And there are many universities from the different parts of the Philippines, like the Visayas and Mindanao. University of Makati has a lot of resources. So there is no reason for you why you should not be high in the ranking. Okay? So let's try it. Maybe we apply for it, And then we get ranked, we get the stars, and we'll see where we fare. But of course, paying for the QS ranking does not stop there, because you will have to keep on working for it so that you know how you are going higher. And that is a strategy that we're going to tell you later on. Now, why do universities want to be top of the world? What are normally the top universities in the world? Give me one. Harvard. What else? Of course, it's there. Oxford. Cambridge. So the Ivy League schools. Okay. Why are they top of the world? And why do they want to be top of the world in the ranking? So these times, higher education. What's the importance of being top? For fun? Prestige? Yes, it is for funds. The income of the university comes from the research grants. In fact, professors in in foreign universities are assessed based on the number of PhD students that have graduated under that person, the number of papers, and the amount of money brought in. So for the faculty members at the back, luckily you don't have that work to keep on writing grants. But that is the culture that we will try to develop within the University of Makati. Because if you receive a grant of 20 million pesos, again, part of it goes to your honorarium. It will be an extra income to your own personal kitty fund, for example. You can keep on hiring research associates, and actually the more money that you bring in, the more people that you can hire, and the more papers that you publish. But for some of you, when you get published in your area, for example, in the field of health, you will be the ones invited to the global bodies. You'll be sitting in one of the WHO technical bodies, for example. That is why I want you to have a research niche, for example. And that will just allow you to be traveling anywhere in the world. You just have to ask permission from the university. But of course, if you're a plenary speaker in the big conferences because you're the person who's the best and prominent in that field, then that will be a big plus to the university. And that is what you call university excellence. When your professors will now be speaking in plenary in big conferences like HIV/AIDS, which has 25,000 participants, and introduced as a lecturer even from the University of Makati, introduced in the big space with 25,000 people, that's a big plus to the university. So that is how you are going to package research for the faculty members. That is very important, that the way we think as a university will be collective and as a group. Because if we have to be greedy, that I just want to publish and I will be the most prominent person in the university publishing with so many publications, but you are not bringing in the others as co-authors, then that will defeat the purpose of a collective effort as a university. So later on, we will see that the power of numbers will be powerful. For example, the 5 of us, for our first round of papers, we will be publishing. Then for the first round, we will have 5 papers, right? For the second round, because we will all be co-authors, we will have 10 papers. Imagine if we have 10 papers in a year times 5. The H indices that will be impacted will go high. And if I click on University of Makati on Google Scholar, the whole university will go up. Do you see now the bigger picture on how we're going to play the game? And if we will publish with the Scopus journals, Scopus has its own H index. And then, therefore, you will see that the H index of the university is also going higher. And that will feed into the ranking of Times Higher Education. And that's the reason why all these universities goes higher and higher, because the researches that they do are impactful. Okay? But later on, we will see that we can also do what they are doing, the kinds of papers that I'm going to present. And you will see here the criteria would be publications and citations of these publications. Now, there's another ranking, Times Higher Education, the impact ranking. You look at the SDGs, and there are so many, and there are a number of SDGs, but they're just going to look at 3. Maybe the research office can try to look at this, whether you can be part of the ranking for the SDGs. This is also part of Times Higher Education. So Times Higher Education works with Elsevier. And Elsevier owns Scopus. So it's a smart move because they are companies. So what is the incentive of doing that? Later on, I'm going to explain. Now let's go for the QS ranking. The big percentage would be citations per faculty. So that means that's 30%. You have to have research. And research is, what was that, Nick? 30% also. So that's already 60%. Plus, academic, no, it was not academic reputation. It was something else, the 7.5%. So you already have 67.5%, which we can do just by doing research. There's the academic ranking of World University Shanghai ranking. This one uses the Web of Science indexed journals. And they will normally also use Nobel Prize winners as part of, and of course we cannot play that, so probably the university should invite also faculty members, maybe a visiting professor who are Nobel Prize winners. We had a few here in the Philippines. There was one with LaSalle, for example. Now for the AD index, this is what some of you know. Look at this. They just use the H index, I-10, and citation. So which means Google Scholar. And that is very easy. So we will just bombard and dump to Google Scholar of all the faculty members and students. You will have accounts with Google Scholar. Imagine, how many students do we have with the university? 10,000. Let's say 5,000 will be publishing because some of their papers, their essays, can be published. I will see you later on that you can actually publish. If it's a group work of 15 students, imagine the H indices that will come out. So one of the strategies of the university is to tap the students in research and publications. Of course, it has to be quality controlled, that they are not predatory journals, because predatory journals are not part of the H index. Why do these companies index and rank universities? Because the government of China, for example, uses it to check if their universities are now becoming world-class, because China wants to be a soft power in education. That is the logic of the governments. So the soft powers in education are, where do you normally would want to go? United Kingdom, USA, Australia, Canada. For example, Dr. Nick here went to Australia for his PhD. I went to the UK. These are the normal superpowers in education. The Philippines has so many universities, 110 million people, and in fact, we are number 13 in population, but we are not a superpower in education. That is what you're going to do as a university. Because once you're a superpower in education, you're an excellent university, guess who comes here to study? The foreigners. So the other countries will come here to study, and then that is now, then you can say that you are indeed a very good university. They will be bringing in tuition fees. So that is the reason why Harvard, Cambridge, not the UK universities, but the US universities can charge as much as $85,000 for a master's degree tuition fee. And you cannot charge that because we have a different regime of payment for tuition fees. But the private universities in the Philippines, have you noticed that? Go to LaSalle, Ateneo, and UST. How much do you pay? Very high. Because they can afford to bring it up because of their ranking. So for the pharmacy students, why do you price a medicine? How do you price a medicine when it comes out? Let's say, for example, you discovered a certain form of medicine. How much do you price it? High or low? Why high? To recover the research and development. Is that the reason? Okay, that's one reason. What else? Why do you said supply and demand, so that's economics. Why do you price it high? Because when it's expensive, people think it's effective. It's just reputation. It has nothing to do with research and development. So, if you come up with a medicine, you ask people, how much are you willing to pay? Have you had lessons already on willingness to pay? If it's a breast cancer medicine, people are willing to pay very, very high, no matter how much cost is the development. And that's with the university ranking also. If some of your programs, we will be charging tuition fees for foreigners, you can put it at a very high rate. However, it is not only that the students will pay for it. You can now go to the Asian Development Bank, to the World Bank, that some of your masters and PhD will be paid by the tuition fees of the World Bank and the Asian Development Bank. So which universities only has that? That's Asian Institute of Management. They have Asian Development Bank scholars. So imagine if you can, and then you can charge as much because the students are not the ones paying. And then, for example, you have governance here, you have public administration. You can go to Myanmar or to Cambodia, and you can bring in a cohort of government officials to do a master's degree, probably a different kind of mode. Let's say, for example, 50 employees of the government, and then you can package it, and then you can say that you are indeed a very good university. But before you can do that, the faculty members of public administration, of the, what's the school here? Government, and there's one school here. I like that one. The public administration one. Yeah, the ones of your university. So if you want that you'll be accepting foreign scholars from other governments, the faculty members have to do research. You know why? Because that is their reputation, that they are world-class researchers. Thus, they can be world-class teachers. So there are so many reasons why we have to do research to become an excellent university. Now, you have been discussing about citations. Citation is also the one that feeds to the impact factor. Okay? The formula for impact factor is very easy. It's just the past 2 years of citations over the number, the denominator is the number of citable items. Remember, citable items. I did not say original research articles. So how can you make it high? Maths people, how can you make the impact factor high? Increase the citations and decrease the citable items. So this will be for your journal strategy. For example, Lancet has just few original articles per issue. 3, 4, 5. That's a citable item. However, they only publish the big papers. Global Burden of Disease, Lancet series, Lancet commissions. So that is how we strategize journals. And so the rejection rate for the top journals is very high because they want to lower the citable items. Knowing this, you will also be able to play the game of citations as a university. Therefore, produce papers which are highly cited. And there is a technique in doing that because as an editor-in-chief, I want my journal in the future to have a high impact factor. Therefore, I navigate, sort of manipulate, not manipulate, but fix the research articles, and I have to be choosy for my future impact factor. Why will I want to have an impact factor? Let's go back to your medicines. Because if it's a high impact factor, people are willing to pay. What is the most expensive journal in the world? How much do you pay? Give me a number. Any guess? 1,000? Higher? Dollars? Do you charge for your journal? Okay. So 0 for your journal. So what's the most expensive journal where you have to pay? Okay. That why. What's the most expensive? 1,000 higher? Any other guess? 6,000 higher? It's $10,500 just for one article, and that's Nature. Where do you get $10,500? Ask from the mayor. Will she give it? No. Obviously not, because that's a lot of money. Remember, the publication fees, it goes to the salaries of the CEOs. This is a $6 billion company, Elsevier, and so as BMC Nature. Okay? Now, the impact factor, so you're willing to pay that. Lancet, by the way, is $5,000 to publish. And for my journal, I'm transparent, it's $2,400 for Wiley. It doesn't go to me, how I wish. Because we have so many, and you know what? People publish. I have so many articles coming in, and they are willing to pay. And these are the top universities. Remember, publication fee is not supposed to be paid by the researcher. It's supposed to be paid by the project or the university. But does the university have money? Well, let's be honest, none. And I also do not want to encourage the universities from the developing world paying for this, because you might as well give it to your employees rather than the journal. So do not be very ambitious in publishing for the top journals if we don't have the money for the publication fees, because there are other Scopus journals which are free. And that is one of the strategies of the university, to find out what these journals are and then feed it to the researchers from the different faculty members. So you have a lot of tasks to do. Unfortunately, you invited me to this lecture. You'll be doing a lot of things, and probably you'll hire more staff, because I will give you the summary of all the strategies of the university. Remember, collective work to become an excellent university, and this is just the start of our conversation. So there are counterfeit impact factors. Be very careful. By the way, you will get the slides. Don't worry. I will give it to the research office, and I will share it with you. Now, the impact factor, of course, are just produced by Web of Science and Clarivate, and other impact factors are not really reliable. Now, this is a very important graph. If you publish more, the quality of your research gets better. People would say, oh, I only publish few, but I only publish quality. Fine, if that is your philosophy. But data would show all the lines that go up, they're the ones publishing more. The quality of the papers goes higher through citations. So that is why we have to encourage the faculty members to keep on writing and writing. Okay? So now there's an evidence, publish more, and later on, because our administration, they're very, very busy, you will see that authorship is not only for the ones who are writing. It even includes the university president, because the university president signs the funds, which is part of the research agreement that they can be co-authors. I'm going to show the guidelines. Now, this is another important figure, which you as a scientist and your journal, there are publications. Do you have a laser? there are publications which are highly citable. If you notice here, 100 plus, and there are a few papers. That is what you're going to hit. So if our faculty members will be able to write this kind of papers, imagine the citations that University of Makati will get. So I will have a different workshop in the future if you invite me. What will be our research agenda to get the highly citable papers? Because that will be a 2 to 3 hour research agenda looking at the different niche areas where it will be highly citable. You can keep on producing many papers, but it will only produce a few citations. But that's a lot of work and that's a lot of money. We might as well target the very big papers to get the university high in the ranking. Now for the ones who are publishing, the ones who are in health, you're all in white here now, try to get your name in PubMed. Because when you look for jobs, people will check your PubMed profile. If you are indeed someone, for example, you want to work for the World Health Organization. World Health Organization, of course, you're not going to be a scientist or a researcher. However, your ability to look at data would show your skills that you can work for them because you'll be given data when you write reports. Okay? And the journal by the way, the journal that has the highest impact, do you know impact factor? Do you know some of them? A good journal with a journal which is good, the impact factor is 1. That's already good. With Wiley, where I work for, the highest impact factor ever of a journal is 500. That is way, 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 way up. Because for a PhD student, sometimes you're required to publish. A good journal with a impact factor of 1 is already good. Yeah. So 500 is a lot. So that is for another workshop that we will do on how to strategize the journals based on the things that I'm saying. So actually now I'm just giving you the overall picture of the landscape of scientific publishing, but we can cut it into different pieces, whether it's for the faculty members, workshop for the students, and workshop for the journal. And I do this with many universities. Okay, let's just move on. Scopus, when you look for journals, because we want to feed to the ranking of the university, be sure that it's only Scopus for now. But of course, you can still publish in non-Scopus journals as long as they are credible, because we will still feed to the AD index. So it's not really a problem, as long as it's not predatory, because we keep on adding to the reputation of the university. So if the whole faculty, how many faculty members do we have? Full-time, part-time, including the staff? 700? Including, because part-time still affiliated to the university, so they can publish. So imagine that 700 publishing and writing, and then we put them together as groups, because one paper can be authored by a number. You know how many, what's the most number of authors in the world in one paper? Give me a number. 10, 100, higher? 300, higher? 700, higher? While I'm getting my water. Give me a number. Thank you. 2,000, higher? 5,000. So Google it now. The highest number of authorship in one paper is a physics paper with 5,000 co-authors. So in other words, we can have one paper for the whole university authored by all faculty members. Let's entitle it Achieving University Excellence, the Case of the University of Makati, and pay for the top journal. Let all the faculty members be co-authors. And imagine if it's cited once, twice, thrice, all the 700 faculty members will get citations. And if I click on University of Makati, 700 times the number of citations, it will feed to the AD index. Guess what happens next year? University of Makati will now become the top university without spending money, because that's what the concern of our VP for Finance. So imagine the beauty of what we are doing. We're not even talking about the production of papers from the students. So these are the strategies which the University Research Office should be doing. There is a Scopus Content Selection Advisory Board. So I want your university, universitas, to be a Scopus journal. Because once you keep on dumping your papers to your own journal, automatically it feeds to the Scopus ranking. So that is why it's urgent that your journal will become Scopus. Which means, why do you only have one journal? When in fact, each faculty can have one journal each, a specialist journal. So probably that is the way forward, and we can baby them because one journal can be indexed in Scopus within 1 to 2 years. Yes. Same thing with PubMed. So let's think about that. You don't need extra money for that because these are just all work, but our staff here will be overworked. Ang dami nyo nang gagawin. Mawawalan ka na ng oras sa girlfriend mo. Oh, online pala to, sorry. Delete. Okay. Now, there is one thing you have to understand, this business. Remember, I told you about Clarivate. You know that Clarivate also owns Web of Science? Well, that's Clarivate. They also own Publons, which is not anymore Publons. They name it. They also own EndNote. And the reason for this is because these are all data analytics company, including Scholar One, which is the system where you upload your manuscript when you submit. Okay? So some of the Clarivate products, you have EndNote, Publons, but this is one thing that I want you to understand about scientific publication, the Web of Science. You have heard of SCIE, right? SSCI. There is no more, by the way, ISI journal. Remember that. There is no more ISI journal. They were bought by the Web of Science. Look at the database. So for the serious researchers here, look at the database. There are 53 million records for SCIE. There are 9 million records for SSCI. What are these records? What are these records? What do you think are this? You see this? Here? 53 million, 9 million. 4.9 million. What are those? Those are publications. So in other words, if your journal is part of the Web of Science, you are now start to feed to the database. And this is where you do your systematic reviews. This is the source of the information. So these are all researches. So what does that mean? It is a rivalry between Scopus and Web of Science. Because you have to buy entry to be able to enter the system when you do your analytics. In other words, Scopus and Web of Science are analytics companies. They are not there for research. Because they will sell the data to the funding agencies so that the funding agencies would know the priority research for that period of time. You buy it because you want to do a systematic review. These are not free. Remember, they have to make money out of this. So therefore, as a journal, will I keep on rejecting papers so that I will keep on feeding to the database? No, I'm not going to reject because I have to increase the database. Thus, rejection rate is not a variable for a good journal or not. No. Rejection rate, it's just because someone cannot pay And if you will notice, if you will go to the top journals with a high impact factor, remember the impact factor calculation? Normally you would expect a high rejection rate. No, they don't reject. Where do they go, the papers? To the cascade journals or the dumping journals. No paper will be rejected. It is now the role of the editor-in-chief to convert that paper into a good paper. It's like a professor whose PhD student has a very bad paper at first, then we fix it and fix it and fix it until it becomes a good paper. So that becomes the role of the editor-in-chief, because we have to keep on feeding to the database. So the higher number of data points, then therefore it becomes, people will buy it more. Okay, then you will say, my paper is about COVID in a village in Makati, as compared to the paper of the professor is about 10 million with COVID in his country. Which one is a better paper? The one with a village, the COVID in a village in Makati, or the one with 10 million? No, there's no better paper. The quality of the paper has nothing to do with the number of participants. Because remember, whether it's a small population or a big population, it feeds to the database. They are all data points. So therefore, why is important even the village researches? If I put a lot of researches, one paper for every village in the Philippines and Africa, I will have many data points that if I am the funding agency, let's say Medical Research Council, I will see the landscape of COVID of the world. So what does that mean as a researcher? No matter how small your research is or how big, you are important, and your research is a data point in the databases, and I can see the landscape of health of the world. So that's how we think as editors-in-chief. We just don't think numbly that reject, 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 though I can reject a paper in 30 seconds. And that is the beauty of being an editor-in-chief, but it's also a big responsibility. So now I think the research office is thinking whether to improve journals or not, so on and so forth. Okay. Now, let's see, it's 3 o'clock. You can ask questions, by the way, if there are. Yes. Yeah, at least I will have a... Oh, microphone, because it's live, sir. Ayan, may break ako ng konti.
As you mentioned, we Filipinos are quite good, are better in English than
Yes.
than other
Countries.
countries,
China,
no?
for example.
China, or even Malaysians and Indonesians, no?
No comment on Malaysia. Baka magalit yung mga Malaysian.
But they have better figures as far as they have better presence as far as research is concerned.
Yes.
I guess the insecurity for us, especially here in the university, is, and perhaps you can suggest papers, publish papers in high-impact journals, and how the paper is structured. Admittedly, here in the university, and I guess most Philippine universities, except for the top universities, the level of statistics employed in researches is still rudimentary. That's the one insecurity, no? And I guess we need help in structuring paper. I have reviewed papers done by our students here in the pharmacy, formerly COAS, and they're very well written, even for an undergraduate level.
Okay.
I guess yun lang
Yung level ng ng
level of
statistic.
writing is quite good.
It's quite good.
It's just, I guess, the level of
Analysis.
not just the analysis. Sorry, it's not the analysis. Sorry, it's I guess the level of research. Yung bang.
Okay, that's a
it's
very
not
good
really,
point.
It's not very deep as far as yung contribution to the body of knowledge.
Okay.
Yun,
So you want me to comment on that statement?
maybe, sir, you can suggest papers published in high impact journals that are accessible, and so that we can dissect it.
Yes, I'm going to show you examples later
Yes.
on. Okay, I'll just a few comments on that. Statistics. Normally, you will say, oh, the statistics is high level. You have table 5 regression analysis. And then therefore, it's a very good paper because there's regression analysis. Go to Lancet, there are papers which are just descriptive statistics, mean, median, mode, because of the topic. Example, if it is domestic violence in rural Philippines, that's a Lancet paper. And you cannot collect data on domestic violence cases, rapes in the rural Philippines in the mountains. But that is a very unique data that you cannot do regression analysis because you cannot keep on asking the different variables. So journals accept that because of the topic. So that's the same thing with violence against doctors in China. Because they already happened, you just see police reports, you can see the age and who perpetrated it, but you cannot do other regression analysis because there are no variables. But that is Lancet. So that's what I'm saying. It can be a highly sophisticated if you have the data, but as long as the topic is good. Say if it's sophisticated analysis, like data analysis or qualitative analysis, plus the topic is good, then that will be for a high impact journal. So later on, probably we will discuss, or in the future, a workshop on what kind of topics should the different faculties have, criminology, nursing, so that we are not copying the papers. It's like this. Me as an editor-in-chief, pandemic, what will be the papers that you will submit to me? Let's say you're the world. The impact of pandemic on, the impact of staying at home during the pandemic. That's most of the things that you will be writing to me. Imagine, if 10,000 papers come to me of the same topic, I will reject the 999 because I won't only accept one. Because you follow a groupthink as a researcher. What we want as editors is to have a landscape of all topics. Because if you submit to me the impact of the pandemic on the mental health of students, my goodness, that will be a boring paper for us journals. But for you, it's something important. So we see we have a disconnect. So that's the same thing with the topics. So probably if we want to have the highly cited papers, unique ones, well-written, and the ones that are very important. I normally call these big papers. Later on, I'm going to show you examples of big papers because that is what we can do. Okay, I'll just move on with some of the slides. We were talking earlier about editorial submission, and I asked you, what do you do for, what system do you use for the submission of articles for your journal, Universitas? Is it just through email? Google Form. Okay. That's a major problem. But it's only for the university. Okay. There are 3 systems which I know which are used internationally. That's editorial manager. This will be a headache for the finance because these are softwares like what Dr. Nick is is selling. The ARIS systems, that editorial manager used by BMC. This is an example. You log in, you enter your, and look at that. It's interconnected with your ORCID, and so on and so forth. Okay? Wiley uses Scholar One. So that's another system. You enter. Remember, I already mentioned Scholar One is connected to Clarivate, to EndNote, to Publons, because they are data analytics. All the data will feed. And I have a feeling NVivo and Mathematica are all interrelated to this. That is why when you publish a paper, the following day, you will have a lot of spams to review a paper because you entered your data in the system. The keywords and everything, your data is harvested and it goes through, I don't know if it's sold, but it's shared. So that is why, don't say, oh, I'm a good researcher. I received like 100 invitations to review. No, you're not. It's just your name was entered there. So therefore, they saw your, and the system can choose that you will be the one reviewing their paper because the paper is from the Philippines, and then you're from Makati. So therefore, you're the nearest in terms of the analysis of the data. That's one. Now, the disadvantage, if you're going to do the Google form, for example, is Scopus will not be happy. You know why? Because a reviewer is not supposed to be linked to the author. And you have to provide evidence that the reviewer is not related for the past 6 months, not a co-author. And that is done by editorial manager and scholar one. Or by the OJS. So these are the ones that is done by Acta Medica Filipina, most of the Philippine journals, because this is free. The problem with this is that your references is not interconnected with Crossref, so on and so forth. But I think they're trying to fix it. So Crossref, DOI, ORCID, EndNote, references, and Vivo, they are all interconnected because they agreed that the data there will feed here, and so therefore, including the citations will be counted. That is a disadvantage of. But for the integrity of the researcher, we would not know that you are fixing the reviews because you are not supposed to be a reviewer from your own university. That is why we reject reviewers with the same emails. Remember, some journals will ask for emails. You suggest reviewers. If you have the same email as the author, no, you're not allowed. That's biased. If the journal keeps on doing that, there will be a lot of retractions in that journal. And retractions is not good. Or you will be dropped if your self-citation is very high as a person or as a journal. So if your self-citations of the same journal is very high, done by the analytics, you will be dropped from Scopus, Web of Science, and also the other indexing companies. So that is one thing you have to understand. So I hope the research training that you'll be getting will have all this detailed information, but I have more than what I'm telling now because we just have a few hours for this. We will have a different workshop for journal management because I think now I convince you that having more journals is better. Because there's no point. It's just like you divided your multidisciplinary journal into 10 sub-journals. So you just increase the number of papers, then you have 10 journals of different topics. So if you have 10 journals as University of Makati, get papers from the rest of the Philippines and abroad, then apply to Scopus, then you have 10 dumping grounds for your papers as University of Makati, and it will feed to the research excellence of Makati. You get it? How to play the game? So having one journal will have some disadvantages. Besides, it's a lot of work for one journal. Why not a lot of work for 5 journals, like what the other universities are doing? One journal per faculty, for example, University of St. LaSalle. Okay. I will not go to the details. Predatory journals, as much as possible, well, not as much as possible, be sure that you do not publish in predatory journals. Now, how do you control the students that they are not publishing in predatory journals? Because later on, it will start coming out on the internet. Remember, digital footprint is always there forever. Once the students or the faculty members publish in predatory journals, it will be there. And that's a shame to the university. You have to establish a university guideline that either you vet their faculty. Every student should have a co-author who is a faculty member. Besides, it's an advantage, you students, if you write papers and you keep on inviting your professors as your co-authors, your teacher will be promoted or get incentives. And your incentive, you will get higher grades. Because next week, your lecturer will ask you to write another paper. the following week, your professor will ask you to write another paper. And you keep on writing papers, you will be the best student graduate of the university because you published more. During the graduation, you go to the stage, you'll be given honors. At the same time, your lecturers who are co-authors will keep on increasing their H index. So you see the parasitic relationship of each one. Being friendly is good. And it also feeds to the university. But of course, I call it beauty because that is how you do it. Preprints, maybe we don't discuss this. We'll just discuss this for the whether it's advantageous or not. Because preprints is a bit problematic. You know preprints, right? The faculty members. Okay. A preprint, you publish it with a preprint server, but you're given a DOI. So for example, the first one is MedRxiv. There is no peer review, you just upload it. And then you submit it to a journal for peer review, and then it got published with BMJ Global Health. The same paper. However, this one went to peer review, but it was already scanned by PubMed. So that's a preprint. The disadvantage is, because the preprint is given a DOI, your citations will be separated. So one citation's there and the citation here. So in fact, the citation should just go to the real article. So that's the preprint. Your journal is digital. Is it digital? Does it have DOI? It doesn't have. So no one cares about it for now. I'm going to be serious. Because DOI is a must for credible journals. You have to pay for it as budget from the VP Finance. That's not very expensive, the DOI. Because the DOI is, you know DOI, right? Yes. It's very important that the journal should have a DOI because that's part of credibility. And that's run by a foundation. So they don't make money. It's just a few cents per article. And then the university can have its own DOI. Crossref, try to find out whether the journal can be enrolled in Crossref. Because it's also very important, the citations will start to meet. I have a feeling that you will call me one of these days to discuss your journal. I just live nearby, so that's fine. Nick will not be driving me. Crossref, we're not going to discuss that. I already said it. When you have figures, you know, when pharmacy students, you upload figures, right? You read papers with figures, like the drawing of the molecules. So this one has, when someone publishes with a figure, you try to understand Creative Commons because you cannot just screenshot and upload as a research article. There are intellectual property things for this. So that's Creative Commons. You see, you have a lot of things to do for your assignment, University Research Office. Your journal is open access. We're not going to discuss that. Where does the money go if you pay $10,500? So normally this is what they say. Eventually, in the future, let's say 3 years' time, your journal will be very high. I like the name of your journal, by the way. It is, you got the right name. I hope you can, it has already ISS. Okay, very good. ISSN. Both, very good, because it's difficult to get the name. The name of your journal is quite good. You're lucky. And same thing with my journal, we were able to get the name because now it's a fight of the names of journals. So in the future, you might be able to charge if it goes very high. And that will be an income for the university, especially if you charge it as much. If it's international, it's in US dollars, then you can hire more people for the journal and for your number of journals. And you have to understand where the money goes for the journals. You have to have a good understanding when you start asking for payment where the money goes. Okay? Because you'll be advertising, so on and so forth. Okay, let us go to some of the techniques in publishing. There are many countries which do not have to pay. Full waiver. So the faculty members, when you attend conferences, try to meet some of these people who are from the full paying countries and let them be the corresponding author because they don't pay. They're just Just be a user-friendly person. Add them on Facebook and then ask them, can you be a co-author, but you'll be the corresponding author, so that the university will not pay, especially the expensive journals. Okay? So that's one. Philippines pays in most journals. It's 50%. So if it's Lancet, it's 2,500, and that still is a big money for the journal. Everyone should have an ORCID. So this is what we do as a university. Why don't we have a survey of the faculty members who have H indices, who has ORCID accounts? I think most of the senior faculty members have this, because again, it shows your profile as a person. Okay? Then the university is also there. The peer review process, all journals go through a peer review process, and I think you're doing this. Hopefully, it is, your peer review is single blind or double blind? Double blind. Wow. And most of the articles are from the university. Oh, then that's good that it's double blind, because it's difficult if it's within the university. You know, the only problem with that, if you submit it for indexing, it's because your reviewers would probably come from the same university, and they will call it bias. So try to read on this so that you can start preparing for the indexing for Scopus. Because normally it would be someone not related to the authors. And being in one university is a form of relationship. So that's why the websites can fix this. That's why you're double blind, because if it's single blind, then it will see the authors. And okay, let's not go to the peer review. We'll just have another workshop for that. Now, this is a very important slide. You only know research articles. So you're doing research in the university. However, remember the citable items that counts for the citations? Letter to the editor, editorial, and commentary, and only those two, they are not counted. But they are counted for H index. The rest are counted. Commentaries, perspective, and news is also not counted. Commentaries, perspective, they are counted. And I call them high school essays. So therefore, what does that mean? Dump Scopus journals with many of these papers from the students. And there your H indices, your Scopus citations will go very high. When I say high school essay, definitely it's a high school essay. Read Lancet, the correspondence, they're just essays. So you can do that. The papers from the master students, from the PhD students, try to convert them into perspective. A perspective for my journal is 3,000 words, essay. A commentary is 1,500 words, essay. While original article, you have methods. Review paper, you have methods. The rest, policy review and policy analysis, this is good more for the governance college faculty. They have methods, but the rest do not have methods, and they are simple essays. But simple doesn't mean it's simple. So that's also one thing that you have to consider for your journal. Your journals only receive original articles, and you have editorials. You have editorials. Okay. When you migrate it to Scopus, they will not count the editorials. They will only count the original research articles. However, in Wiley, we have 500 types of papers, including news and obituary. You know what an obituary is? Pag namatay yung tao, may sinulat, yun yung obituary. That is not citable. That is not counted in the citations. But that is still a scientific article because it's published in a scientific journal. Have you noticed in some journals, they talk about a dead scientist? That's an obituary. That's part of the 500. So that's another thing which you have to discuss later on if you will be having other papers. Remember what I told you, a journal is a platform for power and influence. It's not only about research. So if I have a perspective on good governance in the Philippines, that's not an original article, that's a commentary or perspective. That is citable. So it will start counting on citation. So that will be the papers for the governance college. For the pharmacy, probably it's more. But if it's access to medicines in rural Philippines, that can be a commentary. That can be counted for citations without spending a single cent. Because remember, citations is just the metrics. Whether it's impact factor or whether it's ranking of the universities, whether it's the AD index, whether it's Scopus times higher education, etc. Wala namang iba na metrics. Except, of course, you can have metrics like the number of papers published. That can be used as one. But of course, for the promotion of the faculty members, you have a different guideline. Because you now have to have a research article to show that the person is a scientist. However, if the person has 10,000 citations for a commentary, you might have to give an extra point for that commentary because it contributed to the university ranking. So that was also an effort because he hit the right topic. So that's now a case-to-case basis whether it will be used for incentives or promotion. Kasi kung puro naman commentaries, hindi na rin maganda. It doesn't show the person is a scientist. But that is for purposes of promotion. But for purposes of ranking of the school, voila, you have all the tools. Yes, sir? Dami yung natututunan.
So meaning to say, sir, our students now have a broader choice of the kind of paper they want to...
It's up to you because you're the university leaders. You can ask them to write commentaries. You can publish their, which is another thing that we will be doing. Harvest all the previous research articles and convert it into original research articles. Yes. So it is up to the university to come up with these guidelines. But of course, to create a research culture for the university, that's a different story. Because remember, you're not even able to get the faculty members to write. How much more the students? So that will be another workshop that we will be doing in the future. Okay, I think you're getting the point now on the different ways. So choosing the right journal. You like impact factor, you like Q1, Q2. Oh, now we go to the Q1 and Q2. Now that you have discussed Q1 and Q2, why will you incentivize Q1 and Q2? Nothing, no reason. As long as they are indexed, it contributes to the ranking. Q1, Q2 is just based on the impact factor of the journal, whether they are in the quartile 1. It doesn't mean that the journal is extremely very good. So the important thing is that it is indexed because it feeds to the ranking. Nothing more. It's just additional pride, of course, that you're able to publish with Nature, and then that's a headline for the university website. I'm going to show you publications with Nature and Lancet that the students can do that without paying a single cent. Okay, we will have examples for that later on. Okay, we'll just start to wrap up. You can start asking your questions. There are many free journals. That's a good thing. That is now your responsibility to identify. So what we will be doing is journal-targeted papers. Because what we're doing now is, do a research and find the journal later on. We will change the paradigm a bit for some of our papers. We write for a journal. Example. These are, I just have 3 here, examples of journals which are Scopus and high-level journal. International Maritime Health. I'm a board member there. Anything that has got to do with seamen or fishermen. Why don't you do research on the boatmen of the Pasig River? The understanding of the boatmen of the Pasig River on climate change. That's a very good paper. Submit it to Maritime Health. That's maritime. Or the perception of dwellers along the river of Pasig River. Remember, our research should be community-based because we want to help Makati. Oh, and their perception of climate change, of the people living, dwellers along the Pasig River. That's maritime health. So you see the beauty of research. You target the journal, Scopus, then you have to start looking for the money to pay because that's a Scopus and it's free. These are all free journals. Same thing with Christian Journal for Global Health. So we publish there. What papers do you think can you publish for a Christian Journal of Global Health? Give me one. Think of something. Christian Journal. That's a scientific journal. We published one. Okay. We did a policy analysis of church going in the Philippines during the pandemic. That's the beauty of being a scientist. You can create ideas and give it to the journal, and it's free. If you have problems with your hair, write a paper on hair. That's the Journal of Trichology. I don't have hair, so I don't have a problem. That's a Scopus journal. Okay? Ayan, nagising na kayo. Of course, we have ethics in our papers, and I already learned that you are doing that. Very good. The only comment I have for ethics here in the Philippines, we want to let the ethics committee be the police of our work. No, that's wrong. The ethics committee is not the police. You yourself police your own research. You don't let an external body tell you that what you are doing is right or wrong. It's like you're going to the party. Every time you go out of your house, you don't ask permission. You assess whether it's safe to go out or not. You don't let your mother be the ones telling you it's good or bad to go out. That's the way you look at ethics. For the authorship, this is very important for the research office, just in case there are questions on authorship. These are the ones who can contribute to the authors. So even the project administration, the finance office, he can be a co-author for a certain paper. Kasi purist tayo eh. Pinapa-author lang yung nagsulat. Actually, your statistician, these are international guidelines. They can be co-authors. So the people working at the office can be co-authors because they are part of project administration. Okay, so you have now a basis for, I'm not going through the details of doing research. We'll now just go to some examples. I'm not going to teach your research methods, by the way, because your faculty members are good with that. That's not what you will get from me, because you're already very good with that. We'll go to the strategies. Let's just go directly to the... I developed a program called Global Health Focus. So this is an international program. I'm known for this program. We develop a community of thinkers, leaders, and innovators in global health. I go all over the world to deliver this program, and maybe I can implement it, the Global Health Emerging Leaders Program, because I want the young students to become global health leaders, to become the head of the World Health Organization, so on and so forth. You can even become the head of the World Bank. Do you know that one time the head of the World Bank was a medical doctor? He was a medical doctor. Okay, so I go all over the world because this is part of my work where it feeds to the journal. So I train young people all over Africa. And part of the work is production of papers or creation of evidence. Normally, we mix papers, okay? So remember, those students are your age. So I will gather, for example, 300 to 500 students in Sierra Leone or in Congo or in Sudan. And then we do a 2-day workshop, part of which is research evidence creation, so that the young people can write papers and produce papers. So what we do is we mix papers. So I have a target every year, 23 in 2023. So imagine, young people like you, writing papers. So you set yourself in that scene. So some of them will be review papers, and they're very good. You just teach them, handhold them, and they can produce papers. So probably what we will do with the university, we also have targets. Don't let it be a freewheeling initiative, because if today they attend my research methods, a research motivation class, the halo will be good only for 3 days. And they will say, they'll go home, I'll want to do research. After 3 days, they will forget. It's like going to church. After 2 days, you feel good. On the 3rd day, you do bad things. That's the feeling of... So you have to handhold the faculty members. Example of the papers that we produced. Nature. So look at the topics. So these are undergraduate students in Iran and Afghanistan. So vaccinate people in Africa's prisons against COVID. This is Nature, the most expensive journal. Okay? You see how we create the topics which you are asking? You look at topics which we editors love. That is why you ask, do you like this paper? Or you set what, you know, the editors-in-chief, they're the best friend of the scientific community because they can make or break, especially if there's a PhD student who wants to publish. So they would normally ask if this paper, like I'm a best friend now of UP Manila because they have many PhD students who needs to be published at once because it's PhD by research. They have a program there. They only, which is another thing which I have to remind you. There is a program where you can do a PhD just by submission of 2 papers. They will evaluate, and then you get your PhD, you graduate. That's PhD by research. That is being implemented now by UP, but it's already being implemented in the UK without doing a master. And that's a legitimate PhD because PhD is just by research anyway. Like I did my PhD in the UK, first day, do research at once. So 2 to 3 publications, you graduate. But of course, it goes through an evaluation. Okay? I am smart, so I thought I should write a paper before the first typhoon of the Philippines comes during the pandemic. That's Lancet. With students. We even have an African student here. So Philippines braces for typhoon season amidst COVID-19. So you have to be very creative in your paper. So when I say big paper, since I'm a global health specialist, I write big topics. You know why? Because I want it to be highly cited. So this is one of my highly cited papers, Can Africa Achieve Herd Immunity? So that's the way I think. I look at the picture, the big picture. And these are all top journals. And of course, we don't pay. So some of the examples are for the health people, and I'm just showing here health papers. If you have no other topic to write about, think of any disease. Then work with me on that paper, then we can publish it. There are thousands of diseases, so you'll never run out of papers for the health people. And so these are the young students who I work with, okay? Look at their faces. Again, we always talk about Africa because most of the students are about Africa. I was introduced as a health financing person. So before someone else writes on who will pay for the COVID-19 vaccines, of course, I'm an editor-in-chief. I know what I want. I write at once. Some of these are commentaries. So that's the same thing with, so do not let the opportunity to write on an issue when it's there. For example, what are the issues that we haven't been writing about? Pregnancy, teenage pregnancy during the pandemic. No one wrote about it. And that is a very, very important topic because we thought of it as just something normal. Remember, pregnancy among the teenagers went very high because they were all confined at home. That is very, very important because apparently it's a phenomenon that happened all over the world. So in other words, we can have contributed to the literature. Damn if you do, damn if you don't. So that's how you entitle papers. It's wrong spelling of dam because it's about the dam. It's about the dam in Ethiopia. As I told you, I travel all over Africa and the world. If they dam the Renaissance Dam in Ethiopia, the water will not flow to Sudan and to Egypt. So agriculture in Egypt will be affected, and so as agriculture in Sudan. If they don't dam it, there will be flooding in Sudan. So damn if you do, damn if you don't. The top journal liked it. So that's the beauty of being a scientist. You create ideas, and the good thing with publication is it is a form of archiving information. In 100 years, all these publications of ours, if the pandemic happens again, we will go back to these researches. That is one of the purposes of research. You are archiving history. That is why we now have a category of news in the journal. That is the reason why we don't have information of the Black Death, because no one published it 100 years ago. You see the importance of what you're doing? If you have nothing more to write, talk about the street vendors. Look at this paper. It's a top journal, Scopus. Africa should not forget street vending practices. We have a lot of street vendors in Makati. There are more other examples. We normally look at countries, Vietnam, Sudan, big papers. We had problems with oxygen. So I told that once to my researchers, let's write about, I'm the senior professor here, and the rest are all students. They do the writing, and then they publish. Of course, there's politics in publication. When it's single blind, they see the authors. Sometimes they will check your name. But if my name is there, no journal can reject it because I'm a globally famous person. You're lucky. I'm just joking. No, seriously, that's part of it because I use my affiliation of London School of Hygiene, Tropical Medicine, and no one can reject any paper if you have that affiliation. That is probably one of the challenges we have with the University of Makati. We have to be honest that it's not as prominent as the other universities, but once we start bombarding journals with our papers, voila, you'll be one of the best universities. So my wish for you, the University of Makati, we can actually do it. Seriously. If we try to play the game well, avoid too much politics, we can argue, we can discuss, but I know I gave you now a very big responsibility. Sorry you invited me. So I will now go to the last slide, the strategies on what we do next. Oh, if you have nothing else to write about open defecation. That's a +1 journal. That's a top journal. So even ordinary topics can be published. I like the concept of aging. So Dr. Nick is an expert on aging. No one writes too many papers on aging in the Philippines. Aging in urban areas. You can even have a center for aging here in University of Makati because Makati has a lot of aging population. So that will be one. So probably to address the needs of the city, have research areas which the city needs. For example, the urban poor, urban health, then at least we help out the city just because it's funded by the city. Or the business sector, so on and so forth. But we can also create other kinds of research areas. Okay, let's now lastly go to the strategies. These are all the, remember we write hundreds and hundreds of papers and I'm actually better than any top university of the world because we produce more papers than any other university. Oh, these are some of the pharmacy papers. Analysis of pharmacy workforce in Nigeria. By the way, this one is a grant, which we will be talking about grants in a little while. We submitted a grant to United Arab Emirates. They are sending people, they tried to sending rockets to Mars. So what we did, we submitted a paper on the simulation on how many people should we send to Mars for it to survive. So in our simulation, we sent 1,000, everyone died after the simulation. So eventually our conclusion is we have to keep on sending. That's why they're sending rockets now to Mars. So this was a winning paper. Okay. Let us now go to, I'm just looking for papers on, oh, here is an example of another pharmacy paper. This one, you can do this. These were done by students. medical pharmacy education in Nigeria during the pandemic. That's it. Simple, just based on your experience. Okay. Now, this one is good for you also. Drug supply shortage during the COVID-19. You know, one of the techniques I've been teaching with these young people, at first we started with writing for newspapers, because before no one was interested in writing. And so they listened to the lecture, for example, treatment of diarrhea, a pharmacological treatment of diarrhea, 1-hour lecture. When they go home, they write about it, and then they submit it to websites that they get money for. Health sections of newspapers have nothing to write. So that's what they were doing, and that's how they were learning how to write until we started writing for scientific publications. Apparently, they were almost the same writing. We have written 19 book chapters with the students. I keep on telling about the students because this is a program that I've been doing. That's a lot of book chapters. So I will be writing for some of you. I will show you my email and WhatsApp and Viber later on. You can message me. I can work with the faculty members and the University of Students. So these are some of the books which we have written for. And I have a project on another book. Then probably we can ask some of the faculty members or groups to write. I also want you to identify your best students whom we can use as a pool for our writing, because they have more time than the faculty members. And the faculty members, of course, are very busy, and they are supposed to be more in the management level. Now, grant writing. Grant writing is very important because that's a way for the university to get resources. There are so many sources of money. The only thing is, no one writes. So that is why I will suggest to the university to come up with a committee only for grant writing, and also for the staff who will be focused on grant writing. I will feed you all the grants. Because currently now, we have a number of grants. For example, this one, we won it, $30,000. And normally, it goes to your pocket. So you have to have guidelines, especially if the faculty or student wins a grant. You have to monitor it, how much the university is earning, because we will put it on the website. That means the more grants you win, the better the name of the university is. This one is $1 million. Food security. That's very easy. There's a lot of food security in Metro Manila. There's so many, and this one is very good for the students because this is for emerging, especially the staff. This is 330,000 pesos. And it goes to your bank account. Don't tell the university that you applied for it. Just tell me. I will be your supervisor. You don't have to spend that amount of money. You buy your laptops and your car. 330,000 pesos. You don't have to give receipts on what you're doing. You just have to work on a certain topic related to health, and then that's it. And these are just desk research. We do this every year, and they will give 5,000 pounds for students and young faculty members, especially the health ones, because this is health. So you check this out later, and then we will write your grant. It's only 3 pages. I'm serious. Very, very easy. I will teach you because you should be the role models for the university, the staff. This one is very good. First grant is $10,000. Second grant is $26,000. Third grant is $65,000 for students and young faculty. It goes to your pocket. So be sure the research center knows all these grants being written. Okay? So many of my mentees have won this grant. Okay, so for the way forward, for the students, you have to start attending conferences because they are free. I traveled all over the world to 150 countries without paying a single cent for all the conferences that I attended. I click on the scholarship. They will pay for the airfare, the hotel registration, everything. I was smart when I was a student because I wanted to travel for free. I used research and conferences. And you can do that also. You can apply to many global health leadership programs. For the smart students, I have a youth editorial board composed of people like your age who come from the top universities because of research. So I was able to pull out a number of students from Afghanistan. They are now at Harvard and Oxford University, just because they were writing when they were young, like you. So they are now in the top universities and invited them to be part of the editorial board. So, what will be our goals? Overall, the goal of the university is we will put University of Makati on top of the ranking in the world. Maybe not the top, but at least internationally recognized. And how are we going to do that? We will revisit the university strategy. I know you already have one. We will just look at it on how to strengthen it. Then we will have workshops on understand the landscape of scientific publishing, as I mentioned here. We will understand the metrics, Web of Science, Scopus, times higher education. We will develop research topics and identification of journals where to dump our papers. We will have research methods training for the new faculty and young researchers. Those are the students. Research grant and project writing to have more money. Introduction to research and publication and writing to students. And of course, we will harvest all the previous papers and convert them to publications. And I think it will augment on your plan of the incentives, so on and so forth. And so these are the activities that you will get the slides that I am initiating for you. So I provided the number of hours for some of the workshops. I have enough time to do this because this is what I do. We just have to discuss the scheduling because I have invitations from all over the world for this. So I assessed your university, the different colleges. We will be identifying probably some of the papers that we will let them write. In the same way, we will ask them to submit what they're interested. We meet halfway so that we can target journals. And there are so many publications that we can write. Same thing with the faculty members of the other fields of study. This is the boy, pharmacy student. I met him when he was in second year. He has more than 100 publications when he graduated, and he's now at Oxford University. He's a scholar out of thousands who applied. He's one of the 30 in MSc in Global Health and Epidemiology. So you'll see him on my Facebook. Another girl from Africa, she's now at Cambridge University, just with publications, another pharmacy students. So that's what they add. So when you go to these universities for your masters, that means your future will be very good. Ataula, he was affected by the Taliban. He couldn't leave. I had to find scholarship for him. Remember the tobacco harm reduction? We got it. I had to do some lobbying. And now he is in Paris doing his Master of Public Health. I pulled him out of the Taliban in Afghanistan. Imagine research. I am using it to change lives of people. And I'm very passionate about that. These people come from many poor backgrounds. Ahmed, young medical doctor from Egypt, he finished his PhD by research after med school only for 1 year. He's now at Harvard University as a postdoc. So it doesn't matter where you come from, but if you have a very strong background, you can make it in your life. Just believe in research. It's not difficult, and you will even contribute to the attainment of university excellence of University of Makati. So thank you very much for listening, and I hope we can work together.
Yon. Thank you very much, Dr. Don. We are surely challenged to find UMak's research niche. Thank you for making us realize that there is no such thing as local university. We are all global university, and we can rank in world universities by strengthening our research initiatives and grants. Kaching, kaching. Yeah. Lalo na, we are really, really proud of these guys kasi every year they produce one of the best papers for Universitas. IOP yan. Walang halong biro. Rest assured that we all here are committed to come up with citable papers to gain higher impact factor. We will surely challenge our colleges, institutes, and centers also to have their own journal. Noted po, we need more people in CUR. Ahem, Sir Rante, Sir Ivan, Ma'am Cariaga. Beke naman. Medj madami assignment, oh. Thanks din po, Sir Ivan and Center for Planning and Development. Sasama na po namin sa budget next time yung DOI. Yan. We will play by the game. Well with you, sir. We will play the game with you, and we believe in research. A round of applause, everyone. We now move to the question and answer portion. Carl, do we have questions from the chat? Okay, yan po. So, from Professor Piano Ferdinand, may I ask our excellent and very knowledgeable speaker on research about his position on the availability of advanced tools such as artificial intelligence, specifically the AI chat GPT. Our students are obviously aware of this, and I assume they're using it already, yay, on essays and maybe on their research papers. How do we regulate this as teachers or research so we train them in writing on their own and not just rely on digital tools? Thank you very much.
Okay. I'm always asked this question in any event that I speak in. It is not the responsibility of the journal to police what you're doing. You as a researcher should be the ones should be honest with what you did. We will have no knowledge whether you used ChatGPT or not. However, in the future, once your paper is published, one reader or many readers eventually will catch you. If they complain to the journal, then that will be liable for retraction upon investigation. We will not police it because you as a researcher, it's your own responsibility of being honest. You have to be ethical as a scientist. When it comes to student work, that will be a different regulation for the university to address. I have been teaching online for 15 years, and it is very difficult to catch plagiarism. So that's why I always ask the students, instead of writing on the online discussion, I ask them to submit through a bin which goes to Turnitin. Then I can catch whether there is plagiarism or not. If it's online discussion, it's the other students who catch the paper. And then they tell me secretly that his or her thing that is written is plagiarized. Then that's when I investigate. But remember, we are not, we don't even know if your data is right or wrong. We just, on face values, accept that you are an ethical researcher. It's not us who may be able to catch you, but it's others. So watch out, and honesty is the best policy, because anything that is online, digital, can always be analyzed, checked, and it will be there forever.
Okay, thank you, sir. Do we still have questions from the chat box?
It's 4 o'clock.
No more. Okay, the floor is now open for questions from our audience here. Anyone?
Anong year na sila? Oh, third year. And
Third
what
year.
programs?
Radtech and pharmacy. Ayun.
Okay.
Radtech and pharmacy. Best papers
Radtech
lagi.
now is way advanced. Like Radtech, they are now into different kinds of modalities for treatment of cancer. We don't have to look at Radtech as just, X-ray. It's beyond that. Therefore, you have to do research.
Yes.
Because you're way advanced now. We can write a paper on, for example, the role of Radtech in healthcare in the Philippines, or the role of health education in advancing universal health coverage. Remember the commentaries? Those are the kind of papers which the global community wants. So that's the same thing with Radtech, with pharmacy, but from a Philippine perspective.
Sir Rante, I think, wants to ask question.
No, it's not really a question, but in addition to what Sir Dr. Don said, no. Regarding the question about ChatGPT, I have in fact came up with an advisory for the faculty regarding writing research that to summarize it, it just tells them, everybody, that you have to disclose your use of AI in your write-up. And also, it's a good thing to note that Turnitin can already detect AI-generated data. So we have already included that as well in our new policy, which is now pending for approval by the MANCOM. And we have pointed out the percentage of acceptable AI-generated data. Thank you.
Very good.
Whoa. Okay.
Patay kayo.
Do we have, yeah, we have one question from the chat box. Let's have it. From Daniel Ibanez, just curious, sir. Parang naririnig ko kung paano sabihin to eh. Just curious, sir. What will be costly to disseminate in context of the platforms that you've mentioned? Ground research or laboratory research?
What will be costly to disseminate? So we're talking here of the cost of dissemination. I don't think there's a difference. As long as it's a publication, it will be the same way. The only thing is, when you publish I think I mentioned this in our earlier discussion, that even if it's not an index journal, as long as you publish for the big companies, they have all the infrastructure to disseminate your information, your results, findings. So once you publish, for example, with BMC, once it's published, it's spread to 1 billion emails. They will spam everyone. So your research is disseminated very fast. They will Twitter it. That's the advantage of publishing with the big journals. So that is why publication is not the end of research. The journal has the responsibility to disseminate the information that is published. So it doesn't stop there. So in terms of cost, the way I get it, the kind of research that you're doing, let's just go to the second part of the question. It really depends on the researcher. Because if you really are a lab-based person, then you have to do lab-based research. The only thing is, it comes out very late because it needs 2 years, 3 years, or 5 years for some biological researches. For the population-based research, you do a survey, then it's faster. For qualitative research, you might have 10 respondents to 20, but you still do analysis maybe a shorter time. So it really depends on the context of the research. But of course, you have to think, if it takes time for you to have original research articles because you're a lab-based person, probably you have to have little papers coming out of the different types of research. I hope I answered the question.
Okay, thank you, sir. Any questions from the floor? Ma'am. Yes.
Ay, dami ng tanong. Nakakatakot na.
Okay po. Hi, Dr. Don. Good afternoon po, and
Hi.
good afternoon to everyone. I'm Stella De Vera Barasi from the Institute of Pharmacy. Sir, of course, we would like to thank you for this opportunity because there are so much realizations, and you have state really the fact that if you wanted to strengthen research culture and achieve academic excellence through research, there must be really a school community effort and collaboration. So thank you so much for that po. And I guess the students, they are really, ano po sila, nakatutok sila dun sa presentation ninyo. And I can say because they are really taking pictures of your presentation, given the fact that you'll also share to us your presentation po. Thank you so much for that. So, my question, sir, is, actually this is a question in mind of the Institute of Pharmacy officials. Because traditionally, when we write papers here in the University of Makati, we have 5 chapters, some 6 or more. And I think some of the schools in the Philippines, they are using the format of the full IMRAD, which is readily to be published in a national or international journals.
You're talking of student paper
Yes, sir. Undergraduate and graduate programs.
for the research part of the
Yes,
program.
yes,
Okay.
sir. Because I guess in the University of Makati, we also have programs who just offer research for one sem. So I guess if they will write their paper in 5 chapters, I guess they will really have like short time to finish their paper in one sem. And same as with, I think the 2 sems in writing a research with like having 5 chapters will not really be enough. So the question is, are we as a university, if we really wanted to strengthen culture of research and achieve academic excellence through research, of course you have discussed about publication a while ago, and if we really wanted to teach our students to publish their paper, could we just adopt the practice of other schools in the Philippines, some schools and international, that these papers are readily
Publishable.
publishable?
You mean in publishable format?
Yes, sir.
Okay.
Thank you so much.
Thank you for that question, but I will not answer that question first. I will let the research office. What do you think?
Okay. There is already a policy po. That's CR policy number 3 kasi po ako po yung nag-draft nun. Wherein each institute or colleges of University of Makati has now the authority to determine their format. So
Their own format.
Their own format. So if they go for the traditional 5 chapters, then yeah. But if they decide to go for IMRAD for their thesis, then yes. Yan. Yan.
Okay. So you have your own policy. Okay, I will answer that from my own perspective. Remember I mentioned about the PhD by research. A normal PhD, like what I did in the UK, we have to submit 100,000 words for the manuscript. However, you also have the choice for the German PhD, for example, to submit only 2 manuscripts with 100,000 words versus 2 published papers. How many words does a published paper have, an article? 3,500. It has nothing to do with the format. It has something to do with the content of the paper. I can write a paper, remember the Nature paper, that's 350 words. That's Nature. But the review papers is 7,000 words. So it doesn't matter with the number of words, it's the content that matters. So remember, a paper is a form of expression of the competency of the student. So the methods are there, competency in lab, and so on. So that's what you are measured, not the length of the paper. So you have to discuss as a faculty which one is better in terms of understanding the competencies that the student will be able to graduate from that program. The number of words, I mean, I can ask them to write 1 million words, and still it's all rubbish. So that does not make them graduate of that program simply because they produce a number of words. So that's how I will we are very critical for our master's program at London School. It's only 10,000 words, master's, no more. If you go beyond 10,000, you'll be fined. Deduction in the points. That's the same thing with exams. We will only check if we ask 1,000 words. If you answered 1,500, we will stop reading on the 1,000th word. We will not give points to the next 500. Many universities have different ways but of course, generally the students think the more words, the better. So they put a lot. Concise writing is very important. Remember, there are projects which last for 10 years, and they will only produce 1 paper of 3,500 words. That's a research project for 10 years. You know that those physics projects? A paper cannot go beyond. Only the Lancet papers can go to thousands, but an original research article is only 3,500. How many is yours in your... You accept... you do by the pages. Okay, because normally it's now digital, so it's the number... No. Yes, it's easier to count. Oh, there's the way you submit papers. You submit it right, then you have your abstract, title abstract, body, keywords, body. Where do you put the tables and graphs? In the body? No, you put it at the end, at the annex. You know why? What do you think? And then you put there, place table 1 here or figure 1 here. Nakalagay doon, table 1 here. So when I received such paper, alam ko na researcher yung nag-submit. The reason for that is the word count. Because if your paper is submitted as a commentary, as a perspective you normally is 3,000 words, and you submitted only 1,800, I will tell you convert it into a commentary to become, then delete 300 words. Okay, what's the significance? Because a perspective you have to pay, a commentary is free. If it's a comment, you submit it as a commentary and it's 900 words, a commentary is 1,500, I will tell you, change it to letter to the editor and make it 1,000 words. Or if it is a letter to the editor of 1,000 words, that's the maximum, if it is good and I want it highly cited, citations, I will tell you, please convert this to commentary because this is a highly citable paper and it will start gaining citations. So that's the work of the editor-in-chief. We have to, so that's why the number of words, I always state, please write it for the body without references, without tables, and for the abstract. You have to follow that because that helps us in our decision making for all these nuances of publishing. We'll go through this for the workshop in the future.
Thank you for that answer, sir. And that's also the reason why the new, what do you call this, template for universitas is like that. There is a specific instruction there for those who are writing that you have to make sure that if you have tables or graphs, you have to discuss it. It's not part of the discussion. Graphs and tables are not part of discussion. Okay? So you have to discuss it. You don't say, please, as table number 1 shows, tapos hindi nyo na i-discuss. Yan. When you write your paper, you have to make sure that you discuss the table kasi basically it's not part of the discussion. Yan.
Can you put tables in the method section? Yes or no? You can if there's a need.
Yeah.
Can you put tables in the discussion? No.
No.
Because it's supposed to be in the results.
Yes.
Can you put, let's say, 900 rats were used for the stud? No. You cannot put some of the results. Ito yung palaging mali ng mga researchers. Nilalagay nila yung results sa discussion, as a methods. Pinapatanggal ko yan, pinapalagay ko sa results. Because you don't know how many respondents you're going to interview in the method section. There's so many practices. By the way, journals now, even the top journals, they don't review well. We have difficulties finding reviewers. So that's why you get a lot of spams. So we will invite 100 from the database. Only 1 will say yes. Ganun kahirap na ngayon ang reviewer. So I have a different way of looking for reviewers. You know why I'm doing this, talking to you? Because you will be one of my reviewers.
Ouch. Maraming salamat, sir.
Yun na lang yung babayad niyo sa akin.
Oh my gosh. Okay. Questions from Yes, ma'am. Come over.
May student na tayo. Parami na ng parami.
Hello po. Good afternoon,
Hello.
everyone. My name is Sadil Bulanan, level 3 student from BS Pharmacy po. So, some of us are working on a systematic review. We would
Wow.
like to request for some tips and points to keep in mind in conducting a systematic review research po. Thank you.
Totoo? Tinuturuan nyo ng systematic review sa mga students? Pharmacy teachers.
We have 3 researches po about systematic reviews related, of course, to the pharmacy practice.
And do you publish these systematic reviews?
It's our first time for this academic year.
High level kayo ha, systematic reviews na kayo. And where do you get your database for the systematic reviews? Woo! Wala akong masabi. Kailangan panindigan nyo yan, i-publish yung mga systematic, and I will be happy to accept some of your systematic reviews.
The SAR.
Actually, I am one of a member dun sa group po na ngayon po ay gumagawa ng systematic review. Yung database po namin is Sardine Plus and Google Scholar po. Yun din
Okay, you use Google Scholar.
Yes,
That's okay. Example, give me an example of a question in your systematic review. Anong pinag-aaralan niyo?
About e-prescription po yung focus namin ngayon.
E-prescription.
Yes po.
So what's the research question?
Actually, research question po namin, sir. Nagpo-focus po kami ngayon sa features ng e-prescription system from Southeast Asian countries po.
Oh, that's very good. My God. Kailangan ma-publish ang mga to. Kaya nga eh.
Pharmacy.
Woo! Yung question niya is, where do you get database? Again, I'm not going to teach research methods, the specifics, your faculty members, but I like the concept of e-prescription and those kind of things, and that will be a very good commentary for my journal. Acceptability of a e-prescription in the Philippines, do a survey, that will be a very good topic. Or prescribing during the pandemic, do a survey, that will be a very good topic. So that's how you start creating topics which are very good for journals like mine. And that's very good you're getting into systematic reviews. And by the way, there are different kinds of reviews. Systematic review is just one of them. You have scoping review, you have narrative reviews, you have literature review, you have systematic review and meta-analysis. You have so many, I think 20 plus kinds of reviews. For e-prescription, probably, I don't know if you'll get a systematic review for that, because that's a very specific question, a systematic review. For example, the amount of eggs eaten that will cause hypertension. That's a very specific measure. So probably if it's just the practice of e-prescription, maybe it won't be a systematic review unless there are so many papers. Remember the database that I mentioned? I don't know if you were here earlier. That's the source of all this information. Then your university has to pay for these databases. That's another assignment that you have to do, because if the studentry is now doing systematic reviews, you have to start paying the databases, or they will rely on Google Scholar and PubMed, and that will be not so detailed. Yes. So that's a lot of money for that. So
Thank you po, Sir
let's have a workshop for the pharmacy in the future so we can do the landscape of the different publications. So let's have a competition of all colleges who will produce most papers after 1 year, and we'll give awards for them. Ha? Kasama ang mga students. Ganun na lang gawin natin. Paramihan ng Scopus papers.
Wow.
Mapapagod na siya.
Whew.
But we will monitor all of the outputs. We will make it sure that all the faculties will submit all the publications that will come out. Very good. I love your pharmacy. Ako, nagtanungan na yung mga boss.
Actually, sir, the nursing program already had one systematic review research last year.
Wow.
So, nursing program had one, and then this was followed through now. This is followed through now by the Institute of Pharmacy. So,
very good.
Second run, kumbaga. The first run was with the
So what we will do is just scale it up kasi nasimulan na.
Yes,
So
sir.
paramihin na lang natin ang papers. And maybe you can have like clubs, research clubs. All you have to do is just publish papers.
Yes, sir. And I think we need really the help coming from you with respect to the methodology and the writing of researches based on systematic reviews. Thank you po.
Sure. Very good. Impressive.
Thank you, Ma'am Cariaga.
How many words can a review paper have for the journal article? In many journals, it can be as much as 5,000 to 7,000. It's the longest paper in a journal. Original research article will be 3,500. Kasi ang daming mga sinusulat sa systematic review. Yes, ma'am. Sulitin nyo na, kasi minsan lang ako
na po. With respect to publication po, international, we've tried publishing in a journal of an international pharmaceutical organization. So Asian Association of Schools of Pharmacy, or ASP. So we tried publishing. Will our publication be, say, contribute
Okay.
to the body of knowledge that you're, like the Web of Science, or because it's from in a professional organization's journal.
You want to answer that? I want to let him answer.
Yeah. Will it contribute? Yeah.
Will it contribute
it
now to the database?
Right now, we came up with this legitimacy check of all the journals and also the conferences that faculty are interested to attend to or to publish, where to publish.
Vinivet nyo.
Yeah, something. So we have a way of trying to, and also I've come up with a list of acceptable non-Scopus journals, which we have taken basically from the top 5
like
universities.
the OAJ index.
Yeah.
Directory of Open Access Journals.
And if the journal cannot be, it's not in the list, then it will not be.
For the incentives.
Yeah, it will not be.
However, the answer to the question is, it will contribute to the H index.
Yeah, it will.
Yes. But it may or may not contribute, depends on the indexing of the journal. Oh, there's one thing I want the research center, another work that you have to do. Proceedings of conferences is very important. This discussion of ours can be written as a paper and submitted as a proceedings. Even if it's just 5 people who had a meeting, you can publish the discussion as proceedings, and that contributes to the counting. So do not waste any conference of the university, translate it into a paper, and just look at the main themes of that conference. So that's why in my conference, I have many proceedings, because proceedings is one of them. Do not waste them. So yung mga discussions, paper presentations, you collate them, para ka nag-thematic analysis, and then you come up, you analyze, and then that's the proceedings of the conference. So the category of that is proceedings paper. Do not waste it. Kasi yung napapansin ko, conference ng conference, tapos at ano pa yung conference, napapublish, and it's there forever. Yeah, so that's my suggestion. It's just a lot of work for the staff. Kasi silang mag-record, magsusulat, tapos yung first author, ang president ng university. Siyempre, kasi sa kanya eh. Okay.
Alam na, Carl. Yeah.
Kaya umabsent yung isa eh.
Mark, nasa ka na. Meron pa po ba tayong question from the chat box? How about from the hall?
So students, are you willing to publish now, to write papers? Yes. Okay. Very good. Reluctant, yes. Kung mga Africans nga, dami naming na-publish in top journals. How
Kaya
much
nila yan,
more
sir.
with you? Very good.
Radtech, pharmacist. Galing yan eh.
O pati Radtech, ha?
And
And
oo nga
nursing.
naman. Nursing.
So what we will do next, siguro, we go to the different faculty, and then we will have a different workshop for each. Ang dami nun. Kayo na lang mag-echo seminar.
Meron pa po. Wala na po pa tayong questions, clarifications, suggestions. Okay, so thank you all for your questions. Thank you, sir, for your answers. Palakpakan po natin si sir. Palakpakan po natin ang bawat isa. Okay, so sigurado po, wala na po tayong questions, clarifications? Yes! Ngayon po, to end our program and to award the Certificate of Appreciation we would like to welcome Dr. Nicamil Sanchez, Sir Florante de los Santos, our MANCOM members, Sir Engineer Luke Ivan Moro, and Professor Maria Faye Nanette Cariaga, our University Secretary, to award the Certificate of Appreciation. And I would like to read the citation. This Certificate of Appreciation is awarded to Dr. Don Eliseo LUCERO-PRISNO III for having served as the speaker of the Research Colloquium, Achieving University Excellence Through Research, given this 17th of April 2023 at the Multimedia Room 507 HPSB University of Makati, signed by Dr. Nicamil K. Sanchez, Research Consultant, Florante E. de los Santos, RGC, Director, Center for University Research. A round of applause, please. Yon, maraming salamat po. So, and now we have come to the end of our program. This has been Vincent Barcelona. Till next time, thanks for dropping by. Oh, by the way, there's a closing remarks. Let us call on Ma'am Sir Ivan Moro for the closing remarks.
Good afternoon, everyone. Good afternoon, Sir, Dr. Don. So this has been a very enlightening, afternoon. And as mentioned, the challenge, I guess, for any researcher is, anong topic? Yun. I was talking with Doc Net kanina, and sabi ko siguro they need to be exposed to perversion. Yun lang. Like for example, you know about pagpag, di ba? Ano kayong health effects ng pagkain ng mga taong kumakain ng pagpag, di ba? So that's one. So and I guess you have to go beyond the university, no? You have to go beyond the university and perhaps connect with our other departments of the city. So yun nga, ang danger lang if you explore perversion, like, because ang dami kasing problema talaga sa city government. Like for example, sa MSWD, andun yung mga victims of domestic violence. We have Bahay Pangarap, where children in conflict with the law, yung mga children victims of rape. So, anong effect sa mental health nila or sa PNP? So, you might want to explore perversion. Yun nga lang. And the effects on their health, physical and mental health. So, yun nga lang, you'll be exposed to the dark side of man, and it might have effect on your mental health. But the thing is, the challenge is, I guess our best bet, no, for research is really go qualitative. Talaga, ang dami kasing mga research opportunities on human activities. So we also have a red light district here in Makati, okay? So ano ba yung mga health, at may mga health issues po talaga dyan, okay? So I challenge you to consider, to go beyond. So to consider yung mga yung medyo the dark side of man. Like for example, the effects of poverty on the health, drug taking habits of poor people, di ba? So go out there, do your research, and explore non-academic nature of research, non-academic topics, no? Not the usual, but rather yung the dark side of man. Thank you. Good afternoon.
Thank you, Sir Ivan, for the challenge. Surely our students will go and explore non-academic topics. The perversion of human nature. Okay.